In this video, I'm going to talk about some of the best PA specialties to work in, but not just the best PA specialties, kind of looking at it through the lens of which PA specialties are the same as being a doctor and which ones are very different from being a doctor or a physician. Because in a lot of cases, being a PA is very much like a doctor. So much so that when I'm traveling internationally, it's easier to tell people I'm a doctor than to try to explain what a PA is, because in many cases they've never heard of a PA. They have no concept, no frame of reference. So it's easier and perhaps more accurate to say I'm a type of doctor or something like that when I'm traveling, versus trying to explain this whole thing about, oh, well, technically we're under their supervision, blah, blah, blah. And then they always think it's a nurse in the end and they can never figure out the difference. Anyway, that's kind of a tangent. But let's talk about what PA specialties are similar to being a doctor and which ones are different. So first you have kind of this big umbrella category of specialties where you do almost exactly the same thing as what doctors do, as what physicians do. So here's an example. When I worked in family practice, so that's the same thing as similar to internal medicine, overlaps with pediatrics. So it's where you're just at this clinic and various people come in and, you do whatever, you diagnose them, you prescribe stuff, you order tests, you do all that stuff. Family practice. What I was doing there was pretty much exactly the same as what the doctors would do, 99%. The only difference that really comes to mind is when there was some form that needed a doctor's signature, so you'd give it to them and they would sign it. Because I wasn't the doctor, so I didn't sign the thing that said doctor's signature. But other than that, it's pretty much the same. And you could say almost the same thing about other outpatient clinics, various specialties. Think of dermatology, for example. If you're a PA and you go work in dermatology, are you going to be doing basically the same thing as the doctors? Yeah, well, once you learn the ropes and everything, you'll diagnose stuff, you'll prescribe whatever medications, you'll take a little biopsy, you'll do this, you'll do that. So it's going to be very similar. And then think of a specialty like nephrology, where you're like diagnosing kidney problems and treating kidney problems. Like you'd pretty much be doing all the same stuff unless there's some special procedure that I don't know about that only the doctors do. So there's all these different like outpatient or kind of medical specialties, if you will, medical versus surgical specialties that where you're doing very, very similar to what the doctors do. Now, let's talk a little bit about a few exceptions, a few other categories that are different from being a physician when you're working as a PA. So one broad category that fits that is surgical specialties, of which there are several, right? Whether that's general surgery, which, they take out your appendix or take out your gallbladder and other things, or orthopedic surgery, and they do the operation on your knee or your elbow or whatever, or other surgical specialties, like an interventional cardiologist, perhaps, where they're like going in and doing stuff with the catheters inside your heart or whatever. So those are some examples of surgical specialties. And what's the deal there? Well, the deal is that pretty much the surgeon is the surgeon and the PA doesn't really become the actual surgeon. So then you're not really doing exactly what the doctor's doing. What do you do instead? Well, you probably end up spending a lot of time in the clinic seeing people before the surgery and after the surgery. So that's called pre-op and post-op. And then you might round in the hospital where you go see how people are doing after they got a surgery, like the next day or a few days later. And you might assist in the operating room. So the surgeon's there and you're there as well, and you're working together. So you could participate, but chances are you're not going to be doing as much of the surgery and you're going to be doing more of the grunt work, so to speak. So that's kind of how it works out with the surgical specialties. Another example where it's a bit different being a PA versus a doctor is emergency medicine. Now, I do emergency medicine still to this day. I've been doing it several years. And what I've noticed is the doctors and the PAs, we have a pretty similar knowledge base, though, it overlaps a lot, but not 100% in terms of our skills and knowledge. If you draw the Venn diagram, But the reason it's not completely overlapped is because the physicians spend a little bit more time dealing with critically ill patients, the ones who just had their heart stop, or just had a stroke, or their blood pressure is dropping precipitously, or whatever. Some of those situations where somebody needs to intervene really fast and do some kind of specialized procedure, perhaps, like maybe intubating them or other things, the physicians are more likely to get involved in those cases than we are. And so we spend a little higher percentage of our time doing other things, including more of the not so, quote, advanced procedures like the suturing or cutting open an abscess or whatever. And so in some cases, I felt like I knew more about or had more skill with some of the, like those less emergent procedures that we do in the ER because I've spent more time with it or had some kind of experience that the doctor didn't have. Where on the other hand, they usually have more skill and more experience with the more so-called advanced procedures and dealing with the critically ill patients. So that ends up being a significant difference in the ER, but that's going to vary depending on the region where you work, the hospital where you work, and so forth. Another example where it's quite a bit different being a PA or a doctor is something like the ICU, so critical care, intensive care unit. And why is that? Because again, there are some advanced procedures, so-called advanced procedures, like intubating or putting in a central line, that the physician may be more skilled at. Often they are. And so they might be the one that's handling more of those types of things. And so there's certain things that they're doing that the PA may not be doing. So hopefully that gives you kind of a useful rundown about some of the differences between what PAs and doctors do and to help you understand some of the pros and cons of different specialties as a PA. And I've got another video here where I actually talk about 5 advantages of being a PA over being a doctor. So that's kind of an interesting angle if you're thinking about how it might be better to be a PA in some cases. And then here's a video where I talk about several pros and cons of working in the ER as a PA. So I talked a little bit about the ER here, but I go a little more in depth there. Thanks for watching. I'll catch you next time.